legislation to deal with staffing shortages at Maryland hospitals was heard this week. Advocates say that's one of the reasons we have the nation's longest emergency room waiting times. Sue Copen reports.
Every department from EVS, nurses, general transport, nutrition workers are dangerously short-staffed. Patient care is the #1 goal of every hospital, but short staffing is hurting the quality of care.
Andre Johnson has been a Baltimore hospital worker for 26 years. He says before the pandemic, his department had 730 workers. Last year, that number dropped to 400.
We are dangerously short-staffed, and it's affecting morale. And morale affects your work output. People are taking problems home that usually don't take problems home. They're bringing problems to work that they usually don't bring problems to work.
And the problem is only expected to get worse.
By 2032, Maryland will need about 97,000 more workers to meet the care needs of seniors and their families. Medicaid cuts will only worsen this workforce shortage and leaving seniors without the essential care they deserve.
The healthcare workers and advocates want lawmakers to pass a package of bills they say will fix the state's broken care system. Senate Bill 720, called the Safe Staffing Act of 2025, would require hospitals to create staffing committees to address what are considered unsafe staff-to-patient ratios. Senate Bill 920 calls for creating an advisory group in the state health department, as required by federal law, that would include both healthcare workers and a member of the public to work on recommendations for fair provider reimbursement rates and wages. And Senate Bill 748 will improve the collection of data about and raise awareness concerning Alzheimer's in the state. It's a bill that Montgomery County resident Sue Ronsky, whose mother had Alzheimer's, says is much needed.
In these times where we're talking about funding both at the state and at the federal level, it's crucial. It is so crucial that we keep Alzheimer's and other dementias at the top. It impacts communities, it impacts states, it impacts budgets so much in a negative way. We need to keep a focus on it in a very positive way.
And Ronsky is not alone in her concern about how action in Washington could impact Maryland.
Federal Medicaid dollars flow to states to help fund key services like home care and nursing home care. And these programs are at risk if any of these proposed congressional cuts at the federal level were to happen.
For now, Andre Johnson says he's hoping state lawmakers will move forward on the legislation before them, addressing the concerns of caregivers and advocates.
First of all, pass the bill, and not just pass the bill, have an oversight committee to make sure these hospitals are staffing with the correct amount of people. I don't expect a quick fix overnight. I don't, but this is a step in the right direction.